my clock is showing 2 minutes past the hour. I think we should get going, especially because I want you to know, Raj, how much we value your time. So thank you to everybody who's joined. We really appreciate people signing in, especially at this time of day. We know that you've probably had a really full day of work if you were working on the day shift and may or may not be looking forward to unwinding. But we appreciate you tuning in to join our conversation on why fertility support should be top of your HR agenda. My name is Eileen Burbidge, and I am the Executive Director at Fertifa. We are a London-based company, which is the most comprehensive provider of reproductive health benefits across the UK and Europe. And I'm really, really pleased to be joined by two esteemed physicians, and I'll have them introduce themselves here. But if we could start with Raj, maybe if you could introduce yourself, and then I'll ask Gidon to do the same. And then I'll frame the conversation we're going to have and maybe start with a poll.
Thank you, Eileen. My name is Raj Mathur. I'm a consultant gynaecologist and specialist in infertility. I work in the NHS in Manchester, Manchester Foundation Trust, and I also work in the private sector in Manchester Fertility. I've been in this field for a few decades now, and I'm really thrilled to be invited to this. I've not participated in a Fertifa event before, but I am aware of the work you guys do. I know Gidon for a long time, and it's a real pleasure for me to be part of this. Thank you.
No, thank you very, very much. Gidon, can you follow that?
Yeah, sure. Well, I can't follow, but it's great to be here with Raj. Thanks, Eileen. I've been in the reproductive health field for not quite as long as Raj, but almost. And I'm similarly a consultant in reproductive healthcare. IVF, fertility surgery, and menopause. And just at the start of the discussion there, we were just throwing out a few thoughts about some of the interface problems that we face in hospital medicine with referrals from primary to secondary care, and really how people can get caught up in quite a convoluted system. And one of the things that we're doing in Fertifa is just trying to streamline it and get the process going a little bit easier for people. So that's kind of where I come into it. So that's me.
Brilliant. Thank you. And I don't know if you mentioned you're the medical director for us here at Fertifa, so I want to give that sort of a big thank you very much. So let me kick off with a poll, because I feel like that might help us, at least the three of us, as we're having a conversation, be cognizant of, everyone who's joined us. We've just got a really quick question for everyone who's tuned in, which is whether or not their workplace already has some form of fertility support in place. And that's with a sort of a yes or a no or a don't know, which is often quite telling if there might be, and then people aren't actually learning or hearing about it. So we've got about a few more people to respond. I can see that close to 60% of the people have picked an answer. Maybe we've lost a few people to a cup of tea. We're getting some more answers in now. Don't know if you can see it. Can you, Raj, and see it as it's going in real time as well? Or do you only see the start and I have to end it?
I can't see it.
I don't.
You can't see it. You don't see it at all. Oh, next time I'm going to do a poll about maybe Gidon's tie or something like that.
Yeah. got it out the cupboard.
Okay, great. I think we've got enough of the folks who have responded. So let me just end the poll and I'll show you what we've got. We do have 50%. You can see it now, right, Gidon and Raj? 50% are saying that, yes, their workplace does have fertility support in place. 30% actually say no. And then the other 20% don't know. So that could make it, another 70 to 30, or it could make it actually 50-50, depending on which way it goes in that workplace. But thanks so much for those of you who have answered that question. I do think that's a good place then to start our conversation, if all right, which is thinking about why a workplace might put fertility support in place already, or those who have joined in are thinking about answering our question about why it's important to put into place in future. How would either of you, Raj or Gidon, characterize what sorts of challenges people go through? Gidon, you've already mentioned kind of navigating primary, secondary care and tertiary care and the like, but what kinds of physical or emotional impacts people might then feel as a result of what they go through? Do you mind starting us off, Raj?
Absolutely. So there's undoubtedly infertility or subfertility is a great emotional stressor. There's a lot of research showing that it ranks pretty high in the list of stressful situations and events in people's lives. And particularly after the pandemic, I think, when access to primary care has become a little bit more difficult to get for the ordinary person, people go through quite a lot to be able to see the right people and to have the right tests and investigations. Historically, fertility patients have had problems in that they think they're not taken seriously quite often. It has to be said by medical colleagues and nurses and other people in primary care. And often women who really should be listened to, this is particularly women, who should really be listened to and should have the right tests and referrals, are just reassured and, I won't say fobbed off, but not enough is done. So they do struggle with being taken seriously. And then when they have investigations, they struggle with inappropriate tests and delays quite a bit.
Thank you. I don't know, Gidon, do you have more to add? I think that was pretty comprehensive, but especially because Raj sort of focused on women because they are affected, I think, disproportionately. Don't know if there's anything you'd want to say about men in the workplace then, Gidon, or how that might impact them, whether they're going through the infertility challenges themselves or maybe as a partner or supporter.
Yeah, I kind of think, thanks, Raj. I kind of think, obviously, I agree with the sentiment. I think the thing is that with men need to be part of the conversation as well. And men are currently they have to be encouraged to come along to fertility conversations often. And I agree with you that women tend to drive this. I think there's lots and lots of reasons behind why men need to be encouraged to come through for all sexual reproductive health issues. And this is something that we're dealing with separately. But I think that, I don't know what you think, but the landscape, I think, has changed since I started doing fertility, or when I was a medical student learning about it. And we were there was a different landscape. So you tried, you struggled to conceive, you were investigated, then you saw somebody and the results were repeated, and you went around in this bit of a mouse wheel for a long time, but it was trying and then testing. And I think the landscape has changed for better, for worse, in that people are being investigated earlier. And I kind of think that's probably good for most people because most people have got normal results. It can be upsetting for a few people when those results are not normal. But I think there has been a sea change in this, and the drive towards more information earlier. I think it's probably a good thing, probably.
And a lot of what you have both spoken about then is about sort of the emotional toll. I think one thing that, we often find when we speak to potential workplace clients or even our patients as they're going through things is, these are unseen, right? They're hidden. It's not quite the same as if one is going through the stress of a life event where there's a physical manifestation of it. You can see somebody on crutches, you can see somebody limping, you can see somebody, is injured and the like. And so, any particular observations or kind of experiences you have around that and what you'd kind of flag for workplaces or for managers and colleagues?
As you say, there's no obvious physical sign, isn't there, for subfertility? But that doesn't mean that it doesn't impact people in all sorts of ways. It can be quite difficult to tell, but it does affect people's behavior. And the way they tell us, it affects their work-related behavior as well. One of the big problems people often will tell us is they weren't sure whether to let people at work know. In a number of situations, even recently, in a number of situations, people were anxious about their jobs. They were unsure how the news would be treated, that they were either trying for a baby or, to them even worse, having active fertility treatment. So they were unsure how that would be received. In many situations, they didn't know what the policies were, if there were any policies, HR policies to support them, and so on. So that is quite a common story, even today, when the visibility of fertility, thanks to events like this and so on, has improved. But even now, there still is that problem.
I was about to say, one of the questions that we will often come across as a patient couple will say to us, does stress impact on fertility? And everybody will ask that question. There's a number of answers to that, and people already have their jar of stress is already quite high, quite full by the time they walk into the consulting room. And I think that every couple have stress, however you measure that, when they're trying to conceive. And I say to people, how do you deal with it? How can I decrease my stress? Well, I say stress probably doesn't directly affect fertility per se, but it definitely affects how people perceive the journey. And that perception of the journey, how they're living day to day, definitely has an effect on their work life and every other aspect of their relationships. And I kind of think the stress thing is the effect of stress on fertility and fertility outcome, and then how the work stress is actually adding to that jar of stress. And I think trying to develop a culture within a company and within a framework where it's just part of being alive, being human, and that fertility journeys are normal will actually empty that jar a little bit. And I think that's something that we need to work towards, because we don't think about taking time off for other medical issues. We don't think about saying, oh, I've got to go to the dentist, I've got to take some time off, and everybody says, oh, fine, I understand that. But actually saying, well, I've got to go for a scan for my fertility treatment, kind of like it's a whole different concept, isn't it? It's a whole different feeling inside about what that means, because the employee is going to think, well, does the employer know that I'm trying to get pregnant? And if I'm trying to get pregnant, how's this going to affect my long-term career here, my short-term career? What about my progression through the company? So there's so much added stuff just by saying, I'm going for a scan. But I kind of think that this adds to the overall stress. And how often will we see couples, women, come into our consulting rooms really, really anxious, high shoulders, really anxious, because they're so worked up about it. I was speaking to somebody this afternoon, and I managed to speak to them on time in my clinic. And she said, well, I had to take the whole afternoon off for this call. I can't take another afternoon off for some scans and some further investigations. And I kind of think there's a lot of narrative that needs to change.
No, you're absolutely right. And somebody has kindly, messaged us, which is, by the way, a great reminder. And I should have said to everybody who's joined us today, thank you so much for joining us and taking the time to listen to this conversation. But I know I speak for both Raj and Gidon when I say we would all enjoy it even more if this conversation were with all of you as well, as opposed to amongst ourselves. And so please do message in the chat. You can just message to us if you'd like to keep it with us or field a point to us, but you can also put in Q&A into the Q&A box if it's a specific question that you would like answered versus, say, just sharing a comment with us. But please do engage as much as you can, because we would like that. And we think that makes it a much more interesting another, I guess, 45 minutes, maybe 40 minutes that we've got together. But somebody has kindly noted that, to Gidon's point and to Raj's point about sort of stress as well, there's probably this fear, and particularly for women, as Raj also noted, with regards to stress more generally, that the women will face some sort of discrimination or at least judgment, let's say, if they tell their manager or even a colleague that they're going through fertility treatment, that they are looking to conceive, that they're thinking about starting a family or wanting to become pregnant, and whether or not that's going to affect their standing at work. And I think that's really wrapped up into what you were saying, Gidon. One doesn't think twice about saying, I need to book the day off because I'm getting a root canal, or, I've got to get my wisdom teeth pulled, or even if I've got to get an x-ray because I think I might have fractured my shoulder or something like that, something that's quite, physically visible, and any other kind of physical medical treatment. And yet when we're talking about something that has to do with fertility and one's reproductive health, it somehow is, historically seen as potentially a weakness or something that's going to cause judgment or undermining about one's professional capabilities and contribution. And I think that's kind of the biggest challenge. And so when we think about that, and we think about, we've already talked about the emotional load, but Gidon, you also mentioned kind of making time for treatments or attending appointments. How do you see your patients coping with that? Do they try and then do things back to back and try and book them all on the same day? Do they therefore opt out of things if they don't feel that they're going to be able to get the time off? And what kinds of things can you possibly do to assure people, or is there you sort of need to help them gain confidence in having the conversation at work? Is that what it comes down to?
I think it's difficult, and I think it's difficult in a number of ways. I think, first of all, fertility treatment is dependent on nature and biology, which in its very essence is not predictable. So when you're talking about the treatment and you say to a woman, well, please phone on day one of your cycle and then we can schedule the scans, that's no good if you've got a rigorous work schedule. But I'm also dealing with the fact that you've got a rigorous work schedule that I'm trying to, that I know that you have, and I want to work with you, but I also don't know when your period is going to start. And I don't know. So actually, I think there needs to be an acceptance that we're dealing with biology, we're dealing with nature. It's therefore chaotic. And there has to be a degree of flexibilities in people's minds. However, I think that one can mitigate this by saying we're going to be seeing you for 3 or 4 visits in this 10 or 12-day process. Our scans are normally done on a Tuesday, Thursday, Monday, Wednesday, Friday, or whenever. How about you scheduling some not less important, but some more flexible meetings or work schedules for these days, and that we'll try and work around it. So I think there is some planning that can be done. I think what's more difficult is actually dealing with the moment that the individual leaves the clinic. Because when somebody leaves the clinic, they've just had all this barrage of information about follicles and bloods, and there's time for processing. So I often say to people, please leave a bit of time after your scan just to decompress a little bit so that you can go into your work and actually be ready to work. So I think there's the time thing, which I always say, just schedule these days, but also just give yourself an extra hour, especially, London, Manchester, wherever, where the traffic's crazy, whatever, but give yourself a buffer zone to work with. But, we want to be precise, but it can be difficult because we're dealing with a natural process.
Brilliant. Anything to add on to that, Raj?
Actually, you've said it all, Gidon, but I think one point that comes out from what you say is that there is a slight onus on clinicians and clinics to be as patient-friendly as possible. And it is true that in the last few years, we've learned to manage and monitor things perhaps with a lighter touch than before. So things are much less regimented than they were in, say, IVF treatment than they were 10 years ago. You still need monitoring because we need to keep it safe. But things can be done with a lighter touch. Clinics often begin to scan people quite early in the morning to avoid too much of an impact on their day. We learned from the pandemic that we shouldn't have too many patients sitting in one place for a long period of time. So we've learned to get people in and out as quickly as we can and not keep them stuck in a room. So there is an onus on us as clinicians and the clinics we work in to try and be as patient-friendly as possible. But I think a lot of it is communicating to the patient that inherently this is an unpredictable process. It's a natural process driven by its own rhythms. And whilst we can guesstimate when you will be needed, we can't be precise about it in advance.
Thank you for all that. I think it is the case, and I think Gidon will attest to this. A lot of what we do when we support patients from a well-being point of view is to help manage expectations, try and help clarify communications, what might come their way, what kinds of things they might want to plan around and things like that. Because otherwise, for somebody who's maybe thinking about what they have to do to try and further understand their infertility or the subfertility, it's a black box. They don't know what, where one step or one conversation is going to lead to, what that journey can look like. So that led me to think about, we've talked about the pressure, the fear about judgment, the fear about, maybe being discriminated against or being undermined, the stress, of course, of what they're going through. But then with respect to actual treatment, do you find many of your patients suffer from fatigue? Are there then other physical sort of manifestations, symptoms, or effects? Or is that too individual to say? Does that really vary by person to person?
I think it is quite individual. You will have some people who say, oh, I felt exactly the same. But then you look at their partner and you think, no, maybe that's not completely true. But as people will often feel a degree of fatigue, as you say. A little bit of emotional volatility is almost to be expected because it is quite powerful hormones that are being played with. There are some situations where you can develop actual medical complications, such as ovarian hyperstimulation syndrome. That's a serious condition. Although we've got means of keeping the risk of this condition to a minimum, it still occurs, and it can be pretty serious. And it can be physically incapacitating for quite a few days, even weeks.
Thanks, Raj. I was just thinking about it and Eileen's question, and it was something that I hadn't really thought too much about before on the back of what we were talking about earlier and the issues around the interface between the individual and the employer with the treatment. And I'm just wondering, and this is just an open thought, about whether that dynamic is different with different treatments. So, for instance, if a woman is having egg freezing, is that interface with the employer different from her actually trying to get pregnant at that moment in time? And is there much more acceptance on the behalf of the employer to say, okay, the employee is having egg freezing, and actually that's okay because I don't have to deal and worry about the problems with her going off because she's going to get pregnant. And actually, it's I don't know, that it's just seen in a different way compared to a woman who's trying to get pregnant at that moment in time. So is it fertility treatment that's the issue, or is it the fear of impending pregnancy that's the problem? And I just kind of was thinking about that because I was thinking about the feelings that I see and the emotions that people come into different treatments with. Now, I suppose when I'm thinking about treatments, I'm thinking about fertility preservation, and then I'm thinking about actually trying to get pregnant. So like an IVF treatment, an embryo transfer, etc. And actually my feeling and with egg freezing, and I think you often see this with IVF clinicians in IVF clinic, they kind of like egg freezers because they're quite upbeat. I'm doing something very active at this point in my life to control my future. And although the process is difficult, and I know I've got shots, and I know I'm going to be moody, and I know I've got an operation, but that's okay because I'm doing something quite constructive. And that's different to a woman couple who are coming through for fertility treatment who are just very, very scared because this is the most important thing in their lives that they've ever done, and they just do not know if it's going to work. And I think those two emotional, the paradigms or beliefs or systems are actually very distinct. And egg freezers, we like to look after everybody, but there's a lot of excitement. I'm doing something, and whilst the couple's trying to get pregnant, it's actually a bit more trepidation. So I think that's interesting, and I think that actually then goes into how we deal with how people view their own symptoms and complications. Because the worst thing for a woman couple to suffer is if they're not pregnant after an embryo transfer, where they've got the terrible news and they've got the hormone crash. Whilst with egg freezing, okay, I've got 5, 6, 10, 15 eggs, whatever. It's a really good thing, and I'm going to do it again. Oh yeah, I feel a bit rubbish, but I'm going to do it again. And I think it's this overlay of expectations, psychology, and outcome. And I think that's very different with different people.
That's such a great point. I'm sorry, Raj, were you going to add something as well?
No, I was going to agree. The context in which people take a proactive measure to protect their fertility for the future, for instance, egg freezing, is generally a positive context, unless they're in a situation where they're having to do it for a medical reason.
Yeah.
But the context in which they're trying to conceive, having not succeeded for a long period of time, and bringing a whole lot of experience, baggage, pressure, they're much more in a much more difficult, challenging situation for themselves. Yeah.
So it's such a great point. And, as we've talked about now, there will be some potentially physical manifestations or symptoms or consequences of going through treatment, or even the stress of considering what one wants to do, whether it's being proactive or it's in response to something they're looking to sort of address. We've talked about how much of it may be absolutely hidden and sort of internalized, psychological, the stress, the fear, the concern. We saw from the poll when we started that about half of the people, and actually we've got more participants, so not everybody who's on with us now got a chance to participate in the poll, but when we asked how many that are listening with us have fertility support already in place at their workplace, that was about half. And so I guess it's a natural place, if okay with both of you, for me to sort of segue and start to shift now the conversation into what you think as physicians, as doctors, as carers, as consultants. What do you think workplaces can do to better support, people when you see them as patients, when you see them coming into an appointment, shoulders all up, a little bit harried, thinking about the time they want to take off. And I think some of this has already been implied, but what are things that you would suggest workplaces can do to support individuals going through fertility challenges?
So I'll start off with the thanks. So I think the most, and this has been a process of learning for myself, actually, always been on one side of the relationship, now to looking at it as a whole. And I kind of think that's where we should start, looking at the patient or the person as a whole, and looking at the dynamic between the patient and the company as a whole. So what I'm trying to say here is that companies should try and begin the conversation about having an open culture, whatever that means, and wherever it goes. And different things will be suitable for different companies. And now big, rich companies will be able to have a different culture from a smaller one. But actually, the important thing is actually to name the fear, and then to create a culture, to start a culture around it, to start a conversation of saying, yes, we know that there are female employees here, there are male employees, and guess what? Lots of you are young. You're going to want to have family, and we understand that. And actually, to begin that conversation with a very simple premise like that, you're going to want to have kids. We understand that. And we know that 1 in 6, 1 in 7 of you are going to have problems in conceiving. And we may not be able to pay for your treatment. We may not be able to give you every moment off that you want to go for everything. But we understand, we get it. We understand that you want to have kids, and we're going to try and support you in whatever framework that we can. Now, and I just think the acknowledgement, the naming of the fear is the most important thing, because actually, lots of people would have kids, and it's okay. It's also okay not to have kids. But actually to say, we want to have a culture where everybody understands this, and we want to then make a framework that fits into our company. Now, when I started working with Fertifa, I was kind of stumped to this, like, how do you create a framework for us? Where do you begin? And I kind of think that you have to create a framework that's right for your company. Now, a gold standard for me would be something like you got to flexible days, well-being days, welfare days, or however you frame it. And actually, these are days that are separate to sick leave, separate to annual leave, and can be taken for your own well-being. And we can maybe discuss how it can be used for non-fertility reasons, but we're talking about fertility here. And these are days that you can say, I'm going to have a welfare day, welfare hour. I'm going to take a welfare half an hour. No questions asked. I'm going to go away. And nobody quibbles it, because it could be that somebody's going to use their welfare hour to do something else, to go to the dentist, as we've used it as an analogy. So, and then other frameworks will include that are simple and free, to have companions, fertility supporters within an HR network, where somebody can say, listen, I'm having a bit of a tricky time here. I need to get some time off, or I want to talk through my treatment. I don't want you to comment on my treatment, because it's my treatment and not your treatment, but I just want to decompress, just to get it off, just so that I know that somebody in the company knows about me. So I think having a supporter in whatever way that you can, having the welfare days off, but actually, and there are other things, maybe paying for all the fertility treatment in the world, but I know that's not going to happen for everybody. But actually, what's most important is to start the conversation, to say, we're going to have a culture which, and the culture is, we know that you're going to want to have kids. We know that it's difficult for some people. Let's see what we can do. So I think that's where I'd start.
Thank you. Raj, is there anywhere else? Would you start in a different place, the same place?
I would start with culture. I think that's absolutely right. I think a culture that accepts that there can be difficulties with conceiving and that treatment for that is justified is a good place to start. I think a culture that is generally accepting of the fact that people have fertility as an important priority in their lives at certain stages of their life. Not every person and not at every time, but many people at certain stages of their life will value fertility for all the things that it brings them, and will certainly feel the lack of fertility strongly. So I think that culture is a fantastic and essential place to start. I'm not an HR expert, so I can't tell you what your leave policy should be, but I think, you know, it probably is a good investment to be able to have this these kind of investigations and treatment without kind of devouring your stock of annual leave, for instance. Yeah.
No, that's brilliant. Thank you. And it's for both of you to agree so ardently, I think sort of underscores how important it is, where it has to start with the culture. What I might have heard from what Gidon was saying as well is sort of creating a safe space within the workplace to just have the conversation in the first place. So, and I appreciate that has to be the bedrock for anything else. And like Gidon said, there could be more than, there could be financial support, there could be, you know, financial allowances. Raj, you just mentioned there could be policies which allow for time off. And we've talked about, you know, in the example Gidon gave about people who really worry about being able to make appointments or make time for that. And then, you know, Raj, you also alluded to certain policies, which we'll talk about, you know, how to have the conversation, how to support people, how to help progression, how to manage the time away, the financial aspects and the like. All of this is to say that we did have, and people who have looked at the Q&A box will be able to see that we had somebody kindly ask a question, which was, you know, to say that their workplace is quite accepting and very forthcoming, which I take it to mean that they're you know, inviting people to be very open and have honest dialogues. But they're also saying that if they understand correctly, there probably isn't a fertility support policy or actual formal support in place yet. So they asked what we recommended as the first step. Again, to recap, I think I'm hearing from both of you, the first step is to create that right culture, that safe space. But if this person is saying, listen, I think I've got that at my workplace, it's safe. What do I then nudge the organization to do, or what can I do? You know, my suggestion would be then they do take it to their well-being team or their HR team or their people team and suggest first by saying, listen, such a great culture. I feel, you know, comfortable to ask you, therefore, because I'm not just keeping it in my head and sort of wondering and waiting and seeing, but I'd like to ask, are we thinking about, you know, any kind of fertility support, for example? That would be my suggestion. I don't know, Raj, do you have another way that you think, or you've seen maybe your patients approach it?
I think there could be different aspects to this, couldn't there? I mean, because one thing could be to bring in or create opportunities for employees to get some fertility related information in a kind of non-directional way. So we could, you know, just have an event where someone talks about the options, talks about the tests, you know, gives some information, and that doesn't target anyone specifically, and people can come along to it if they want and not come along to it if they don't, and they're not singling themselves out. So that might be one way to as a next step to do that.
That's brilliant. So offer education and awareness and sort of things that people can opt into or sort of self-service if they see it and they like it. Yeah, that makes a lot of sense. Gidon, anything that you would add?
No, I have. Yes, I should say not no. Yes, I think one of the things that I've seen work well is closed forums, and I know that there's lots of intra company chat groups, and I'm just going to use I'm going to use WhatsApp because that's the only one I really know, where you have to be invited in to the forum, and it may be a subfertility forum, and there's an administrator who monitors, who comes in, who gatekeeps, and also keeps an eye on the conversations. And these I've seen can be anonymous or with people's names. And actually, you may be texting to the WhatsApp group or the group next to your colleague, and you wouldn't know that your colleague is actually having treatment. And actually to have a small closed chat group, I think I've seen that work nicely. I think it has to be a little bit careful about it, but it's definitely something that can be done. And I kind of think that the other thing is to also have formal and informal champions. And the formal champions, I think, is quite obvious, but informal champions is everybody. Everybody should be an informal champion, and we get to be an informal champion by supporting and improving background education through webinars and written information and whatever. So somebody can say, let's just use a different example. Let's just say there's a man who's struggling with a bit of anxiety, depression, and he can say, and he feels confident in coming forward to one of his work colleagues and say, listen, I'm having a bit of a difficult time. I'm struggling a little bit. Do you remember we learned that stuff, or that guy or that woman came and talked to us about what we should do? Can you remember it? Can you remember what the next steps were? And then to work together with an informal champion to try and get to a place. So I think there is structured stuff like the chat groups, and I think, but I like the idea of informal champions, that everybody's included in the discussion so that everybody knows that everybody struggles, because I think everybody does struggle with one thing or another. And actually to improve the discussion and to improve the culture by making everybody a little bit more aware. So there isn't just somebody who you go to, but you can say to somebody, I'm struggling a little bit. I've got subfertility. I've got menopause symptoms. I've got impotence problems. There was something that we spoke about once. Where would we go? And then it can go forward from there.
That makes a lot of sense too. And there's so much actually that you said in there. I think you started by talking about, groups, whether they're closed, whether they're open, whether they're opt-in, or everyone's in them. I think we've seen from a lot of our workplace clients and the groups that we work with that there might be employee networks. There'll be the parenting network. There'll be the moms to be network. There'll be the, wanting to balance work life, pressures, and they'll call it all sorts of different things, but employee networks. And then as you described it, then having champions, either informal or formal. And somebody did ask a question as well. So thank you again for everybody who is chiming in, and also for the feedback that we're getting. It's really uplifting and great to see. But somebody had asked whether or not we knew about fertility champion training. And they sort of, draw parallels to what they're familiar with menopause champions, because we do know there are organizations that will train for menopause champions. And, I would say there probably is fertility champion training. Certainly an organization like Fertifa or others, our peer kind of organizations in the sector would offer that. I don't know if Raj or Gidon, you've seen any other kinds of frameworks to help people be, stronger advocates or allies for fertility champion training, or just for awareness. My sense is it's probably more about people who have taken an interest in the topic, whether they've gone through it themselves or not, but are honestly very good listeners and are keen to listen and keen to, again, sort of help to reinforce the safe space within that group or community. I don't know if you'd have anything else to add, either of you.
I think I think that's a really good idea to have fertility champions. I think personal qualities and experience are probably what will be required there. I don't necessarily think that the person needs to be an expert in fertility. Certainly, they don't need to be a fertility professional, but they certainly need to be a listening person, empathetic, and they need to know where they can direct the affected person, I think
that's right. And I think that there's a difference between being a good listener and a good supporter to one who's providing medical advice. And I kind of think you have to be you have to demarcate the difference between them, because there's lots of people who are really great listeners. I often think people like Raj and I are really bad because we just want to get out what we've got to say. But I think that there's just lots of people who are really good at listening and saying, yes, I understand that life's unfair. Yes, I understand that it's awful where you are, and it is. And let's talk about how we can address that rather than what you should be doing medically. I'm not going to say concern or apprehension but it is my concern and it is my slight apprehension, is that when you have a specialist in a certain service, that they don't bring their own or too much of their own journey into that relationship. So we'll have a person who's been through a particular journey and somebody who's got a different journey wants to talk, and there isn't too much of transferring the counsellor's or the listener's journey onto the person who's coming to talk. That I think is just something that comes with time, and but better to have somebody who listens than nobody at all, because we all feel better when we talk about these problems. So I think just upskilling this listening tools rather than maybe upskilling the fertility tools is maybe where we need to go with this.
Yeah, and I would even go so far as to say, because obviously we're very careful at Fertifa when we hold these webinars, we're trying to help more and more people get aware of some of these issues. We're really keen to get other experts like Raj to chip in, but I think we'd be remiss not to at least mention that either ourselves, Fertifa, or other organizations like us, because there are quite a few others as well in the market, we're also here to try and be, an extension of a well-being sort of support or a team within a company, or to be those champions and to be that independent advice and that listening component for anybody who's going through a reproductive health journey, right? Particularly in this case, and the topic we're talking about is fertility challenges and fertility journeys. So, again, as Raj had mentioned, a lot of what might be the best first start is to make sure that there is signposting, navigation, and then also, like I would say, to just make sure people know where they can go to if they've got questions or they want to hear. I don't know if there's other topics. I certainly got a chance to selfishly hit on all of the questions that I had. I was really curious to hear from Raj and his experience in terms of what he sees when people, take time out of their working day to visit him, to ask questions and the like. And so therefore, if he'd observed things to him that would be low-hanging fruit for workplaces to put into place or for managers to think about for their colleagues, it doesn't sound like there's any regional difference with him being based up in Manchester and Gidon with your practice in London. But I don't know if there's anything else you'd want to add, maybe, Raj, that I haven't actually tried to uncover yet.
I do want to add one thing, which is, we treat people in the hope and expectation that they will conceive, that everything will go well, they'll have a baby. The fact remains that the majority of IVF treatment cycles don't work. And it can be a really dark time, even with good expectation management. The patient knows that their chance of success is maybe 1 in 4. That negative pregnancy test does hit especially hard when it's after a lot of treatment, a lot of injections, procedures, side effects. And it can be a really lonely time. It can be a very lonely time for the couple as a unit, if it's a couple having treatment, but even between the two partners themselves, it can be an extremely isolating time. And at that stage, they don't have any more scans to attend. They don't have any more procedures to undergo. So they can't easily ask for time off or expect support. So it's quite hard for patients at that stage to actually reach out. So I would say to people at work that if you have employees who are undergoing treatment, please be aware of the fact that treatment can be demanding, but please also be aware that they will be getting some very crucial news which could affect them very negatively and also be quite difficult for them to reach out for help at that stage if it is negative.
Such a great point, because we've been talking about really what we assume is the start of a journey or when someone's getting started and how that's going to be intertwined with the work. And as you say, oftentimes the journey is ongoing, but the consequences of maybe a negative pregnancy test or something means that the greatest support is needed, again, when we don't see any kind of physical manifestation or symptoms or anything like that, and people need that well-being support. So thank you for mentioning that. Gidon, is there anything else that you would want to touch on? Oh, sorry, you're on mute, Gidon.
Sorry, I was just reflecting on what Raj was saying, and I think and I'm really going to think about that. It's because actually, from the moment that couple leave the consulting room or we speak to them with the test results, we may not ever see that couple again. And I'm just going to reflect on what Raj was saying there, the intensity of fertility treatment that the couple experience, to then the silence afterwards. And I think that's really difficult. And bring that up, I think it's a very, very, very salient point.
No, it's a terrific point, and it sort of validates why, we often ask people like Raj to join us, because there's so much to this topic. We get asked by our workplace clients all the time what more can be done. And again, it's working with people like Raj and others in the field that we hope we end up bringing more value to our clients, that we all can support patients more, whether they're coming through a workplace or coming directly to someone like Gidon or to Raj, and just how much is involved, from beginning to end, or, throughout the whole process. I don't know if you came off mute because you wanted to say something, Gidon. No, okay, you're good. I was going to say that, given the hour especially, and Gidon will know this, and Raj knew this from our prep, we do like to give some time back before the next hour. Not sure if people still have calls to do, or if they'd have 6 o'clock calls here in the UK, or if they need to go start, getting dinner or getting tea prepped. But we want to give a few minutes back. Before we do that, I also wanted to flag that, first I wanted to recap actually the conversation, which was first and foremost that in talking about putting fertility support in place in a workplace, we want people to be mindful that there are both visible and invisible, or not quite visible, sort of beneath the surface, ramifications that people go through when they are thinking about fertility, subfertility, or even sort of taking control, like we talked about with preservation. And then to be mindful that if an organization does want to support individuals and colleagues, first step would be to create a safe space, just to make sure that people feel comfortable having that conversation. We have talked about how that can be enabled through signposting, as Raj mentioned, making sure there's information, educational pieces, awareness, and that people know that there's this conversation happening and they can opt in if they like, and it's kind of not directed at any single person, but it is there, and it kind of creates this context and this situation that people feel comfortable in. It can also be, afforded through employee networks or groups, closed conversations, open networks, and through champions and that kind of work. And then from there, all sorts of, maybe frameworks can put in place for policies, maybe for days off, for time off, for flexible working, for helping people to consider the number of appointments they might have, for how they organize their time, for when they might need to make time. And as Raj pointed out at the end, also think about time at the end, or, even at the end of a cycle after, there's been, the hormones have been finished, and we talked about the emotional toll and maybe some of the effects of the hormones. But even after that, what happens at the end and what happens next? And that could be achieved again by an organization internally because of investing in that, or it could be by working with someone like Fertifa or one of our peers in the sector. So I think that's a recap. If I missed anything, please, anyone, feel free to keep chiming in the chat or in the Q&A, or Raj and Gidon would offer up. What I was also going to mention was that, at Fertifa, we did do a survey, and it was actually the largest survey to date done in the UK about fertility in the workplace. We did that with our partner, Fertility Network UK. We released those results just about 2 weeks ago. And so if anyone's curious to see those data points, how many people actually, appreciate support, would look for support, what kinds of support and the like, I'll put a link to that in the chat. But if there isn't anything else, and thank you for all of the feedback that we're getting, it does really help us know what's useful to you, and hopefully it's helping Raj know how much we all appreciated his time. Wanted to thank him again for dialing in to join us from Manchester. Thank you, Gidon. It got Gidon to wear a tie. Thank you for everyone for listening in. We really, I enjoyed the conversation, really appreciated everything that was offered up here today.
Thank you. Thank you very much.
Thank you so much, Eileen. Nice to see you, Raj.
Thank you both. And thank you, everybody else. Have a good evening.
Bye.
Thank you.